revenue, we always think about like what will the ROI, return on investment, and in telemedicine business we have to incorporate many factors in it. It's not only the bright and shiny part where you get your co-pays, your reimbursement from pay for performance, as well as the coinsurance. This is a very marginal fraction of your reimbursement. The huge money lies in the bottom half of the iceberg, where you can see that where you have reduced the ICU length of stay, you have reduced uh, the readmissions, you have increased the satisfaction of the patients as well as the staff. All these numbers is going to be there, and it will improve your performance. And whenever the performance is going to go up, definitely your ROI is going to go up. So I'm saying that think in not only in terms of the hard dollar amount in the ROI, there is a huge component of soft dollar amount which we need to incorporate when we calculate the ROI in the telemedicine business.
Yeah, exactly. And in with respect to everything kind of moving toward value-based care, value on investment is very important as well. Especially, I mean, we haven't really touched on the patient as well, who would end up getting transferred. That itself would improve patient satisfaction itself. Also will, be a value that is very important to have during this looking at any business case.
Yeah, I agree with you, Dr. Escaria, because we all know that the CMS is moving more from the work-based reimbursement, like from work RVUs, towards the value-based reimbursement, where the patient and the staff satisfaction and the quality metrics you're going to do, they'll be measured, and the component of your reimbursement will depend on it. So down the road in future, so it will gradually go up, and it will become part of the like a major part of the reimbursement. So I will move to the next slide, and it is the continuation from the previous slide. It tells you that when you think about the ROI or the VOI, I think it is more a VOI than the ROI, because we are looking at the big picture. And in any finance, if you want to make money, then you have to look how we can cut the cost. And how can I decrease my expenses? And that's because it's shown on the left hand side. And how can I increase my revenue, and so that I can have a better margin or better VOI? So we already discussed about it, but I'll briefly highlight that you will decrease your expenses if you have reduced length of stay, if you have reduced mortality, you have reduced readmission rate, you are doing better medication management by implementing the antibiotic stewardship program, and if you are doing better care with the multidisciplinary rounds, and you have all the physicians under one umbrella, that will decrease the mortality and increase your performance and decrease your expense.